All right, welcome everyone. Welcome to DEMSM. Michal Engelman will be introducing our speaker today.
Thank you, Catherine. So welcome everyone. It's my great pleasure to introduce Dr. Marc Garcia. He is an assistant professor of sociology at the Maxwell School of Citizenship and Public Affairs at Syracuse University. Before moving to Syracuse just this past fall, he earned his PhD in sociology from the University of Texas at Austin and spent a few years as an assistant professor at the University of Nebraska-Lincoln, where he won multiple awards recognizing both his creative research and his teaching efforts. He has been enormously productive in the short time since he earned his PhD and postdoc, and he has published many in sort of top journals in aging, both in kind of from the social science and public health perspective. His research has been supported by the National Institute on Aging and the National Science Foundation, among other sources, and he is active on the editorial boards for the Journal of Health and Social Behavior and the Journal of Gerontology, Social Sciences, as well as the Journal of Alzheimer's Disease. His work touches on many topics that I think are of interest to many folks in our community. He's particularly interested in physical and cognitive health disparities among older adults, with an emphasis on the role of racial, ethnic, and nativity status based stratification in these outcomes. He's also written a lot on longevity and mortality, particularly among older Latinx populations, with attention, again, to how heterogeneity and nativity and country of origin and immigrant experiences intersect with gender, socioeconomic status, to really create unique trajectories of both functional and cognitive impairments for foreign-born adults who migrate to the United States. And I'm excited to say that I think we'll be hearing more about some of this today. So please join me in welcoming Marc Garcia. Thanks very much for joining us.
Thank you. Thank you very much for that kind introduction. I think I'll begin now by sharing my screen and we'll get started. Okay. All right, where are we? Here we go. Can everybody see that?
Yep.
Okay. Again, thank you very much for the invitation. The title of my presentation today is Aging and Cognition Among Older Latinos in the United States, Current Knowledge and Future Directions. I'm going to begin with the outline of my talk today. I will start off with a little personal background about myself, and then quickly transition to the U.S. population, particularly demographic characteristics within the population. And also, I will talk about Latino health and aging in the U.S. context, specifically risk factors for ADRD, and the importance of looking at heterogeneity within the older Latino population. Next, I will present to you some of my research using the health and retirement study at the National Health and Interview Study. And finally, I will talk about some of the implications and concerns moving forward, as well as future directions. So a little about me, as the introduction stated, I'm from Texas. Most of all of my degrees were achieved there. I am a Harley Davidson enthusiast, new father, and a big sports fan. Shout out to the Milwaukee Bucks. And then my research interest, as stated, racial ethnic health disparities across the life course. I'm interested in social determinants of health, particularly health, physical health, morbidity, disability, as well as cognitive functioning and mortality and longevity outcomes. The majority of my research has been based on these 4 data sets: the Hispanic EPIs, the Health and Retirement Study, as I mentioned, NHIS, and also the Mexican Health and Aging Study, which is a sister study of the HRS. Very briefly, my research among older adults is motivated by mortality differences, differences in life expectancy, as well as population aging. As we know, these factors contribute to the rapid diversity and aging in our population. And as we could see, currently, Latinos, at least in 2014, among adults aged 65 and older, represented approximately 8% of the 65-year-older population. However, this number is projected to increase dramatically by 2050, as well as that of other racial and ethnic groups. So we know that the U.S. older population is rapidly aging, but it is not only rapidly aging, but it is becoming more racially and ethnically diverse. Next, I'm going to talk about the Latino population, right? Recent data shows that the U.S. Latino population passed 62 million in 2020. We know that Latinos accounted for over 50% of the total increase, which is much larger than other racial and ethnic groups. In addition, we know that population aging is due to many of the usual suspects that we expect: a younger age structure, high fertility, low mortality, and also high levels of immigration. Here, just to illustrate, I have age sex pyramids of Latinos compared to whites. And as we could see, overall, the Latinx population has a median age of approximately 30 years compared to 43 and a half. So a very, very youthful population compared to non-Latino whites. And recently, the population, the Latino population has experienced more increases by U.S. birth as immigration has slowed over the past several decades. Particularly in the past decade, we see U.S. births at approximately 9.3% versus increases in immigration at 3.5%. So before I go further into my presentation, I think it's important to define who is Latino in the United States. And when we talk about the U.S. Latino population, it's important to know that Latinos represent individuals from over 30 countries in North America, in the Caribbean, Central America, as well as South America. And here, the most recent data shows that in the U.S., these populations vary in size. What we know is that the U.S. Mexican origin population accounts for approximately 62% of all Latinos in the United States, Puerto Ricans around 10%, and Cubans 4, Salvadorians, and down the list. So there's a lot of heterogeneity in the United States by country of origin. Specific to the United States, there has been 3 groups that have a long history: the Mexican origin population, the Puerto Rican population, and the Cuban population. However, these populations have been integrated or incorporated into the United States by different methods. Particularly with the Mexican population, we know the U.S.-Mexican War, the annexation. Further down the line, in the 1940s, we saw large immigration through the Bracero program. And we also know that the Mexican population has very high prevalence of low levels of education, occupational attainment, and income compared to whites. For Puerto Ricans, it's a somewhat different situation. We know the colony was established as a U.S. colony in 1900. The migration for Puerto Ricans to the U.S. mainland has been different than that of the Mexican origin population. Importantly, Puerto Ricans are U.S. citizens, so there are no obstacles for them for them moving from the island to the U.S. mainland. But similar to Mexican Latinos, they also have low levels of education. They experience high levels of chronic stress and low levels of social capital compared to whites. With regard to Cubans, we know that the initial cohort of Cubans fled Cuba for Miami during the Castro regime. And we also know that these individuals who came to the United States had a better receptivity than Mexicans and Puerto Ricans to the United States. They were given government assistance. A lot of these individuals, I will also note, that fled, and the ones that had the ability to fled were professionals and individuals with high SES backgrounds. So three totally different groups that we're looking at. One thing I also wanted to talk about and note is that immigration patterns to the United States among Latinos have shifted over the past several decades. Initially, the vast majority of Latinos to the United States were Mexican origin. This makes sense given the proximity to our southern border and the high demand for cheap labor, low-wage labor. However, in more recent cohorts, we see a larger heterogeneity within the Latino population. However, as I previously indicated, most of the growth now among the US population is through fertility and not immigration. One thing I would also like to know is that Latinos are geographically distributed across the United States. So where do Latinos live? Looking at this map right here, we see that the vast majority of Puerto Ricans and Dominicans are concentrated in the East Coast. Similarly, the vast majority of older Cubans are concentrated in the South, mainly Florida and Miami. Whereas the Mexican origin population has historically migrated to traditional migration areas in the Southwest. Finally, among most more recent cohorts, we see larger concentrations of Central Americans and South Americans to these new destination areas in the South. So here's just another map to look at things differently, where the Mexican origin population in the United States resides. Again, as I indicated, the vast majority of the population is located in the southwestern states. However, there is growing numbers across the United States. And again, Puerto Ricans in the East Coast, as we've shown, in the state of Illinois, as well as due to a lot of the recent hurricanes and older adults fleeing the island, we're seeing larger populations in the state of Florida, where Cubans have historically resided in large numbers. And again, similar with other Caribbean populations, we see Dominicans also reside in similar areas along the East Coast and Florida. For South Americans, a somewhat different picture, but again, we see here in Utah a large population of South Americans. Next, I would like to talk about health and risk factors among Latinos. As we know, Latinos have a larger life expectancy than that of whites. Here, in this particular figure, we're looking at life expectancy at birth, and Latinos overall have a 3-year advantage in total life expectancy. However, there are some other indicators, key demographic indicators that do not paint Latinos in a positive light. Particularly when we talk about education, we know that there is a robust association between education and multiple health outcomes. Here, there is a 21-point difference between the percentage of adults with a high school diploma or more education. When we look at individuals who have a bachelor's or more, we see a similar gap in the percentage points between whites and Latinos in the United States. Viewed a different way, I think the point of me showing you this right here is that there are large differences by nativity status, right? Not just in those individuals with high school or less, but also those who have 2-year degrees as well as bachelor degrees. What I'd like to point out here is that foreign-born Latinos are particularly disadvantaged, right, in their educational outcomes compared to both U.S. Latinos and all other Americans. We know the significance of education in the United States as far as resources, income. Here again, large gaps in income. In 2020, we see approximately $32,000 difference gap in household income between whites and Latinos. And as you would expect, the wealth gap is much, much larger among Latinos. These numbers right here are very, very concerning. And if you look at the gap, $153,000 in median wealth between white families and Latino families. And of course, this translates to a larger share of Latinos living in poverty compared to the white population. And we know with education and usually through income is where most individuals receive healthcare coverage. And just looking at the differences here, again, we could see differences among Latinos versus other groups by age categories, as well as differences by legal status, right? We know that Latinos, particularly the foreign-born, have mixed legal status. And as this figure shows, that is a very important indicator for healthcare coverage. And also, there are differences by language. I bring up language because we know language is also poses an obstacle for the foreign-born population, particularly in terms of healthcare. So just again, very diverse histories of Latinos in the United States due to their incorporation in the US. And I will say next, I want to illustrate to you heterogeneity and biological risk. This data right here was published by Marc Garcia and Jennifer Alshire. And here they used biomarkers in the HRS to look at differences between Mexican country of origin and nativity groups. Here in the categories, they were able to look at differences between US-born, foreign-born Mexicans, US-born and island-born Puerto Ricans, foreign-born Cubans, as well as other individuals who identified as other Latinos. And these are just the models, but we could see clear variation, clear heterogeneity in biological risk among older Latino groups. As I had previously illustrated, not only are Latinos distributed across the United States differently by country of origin and by nativity status, but also it is important when we think about contextual factors and where individuals live, how context affects their health. Here, this slide illustrates census regions in the United States and differences in diabetes prevalence by race and ethnicity among older adults, 50 and older, among adults 50 and older. And as you could see in the West Coast, Latinos overall have a lower prevalence of diabetes compared to the Midwest and the Northeast. Similarly, the South also has a lower prevalence of diabetes relative to the Midwest and Northeast regions. So place is very important to where Latinos live. And then we could see, again, just differences in the prevalence by region. And these are for controlled and uncontrolled and controlled models, I should say. And these differences span across region and Latino subgroup. In the South, in the West. And we see similar patterns for hypertension, where there is variation with Latinos residing in the West census area exhibiting a lower prevalence of hypertension compared to groups in the Northeast, the South, and the Midwest. And again, it's just another illustration. We see large variation, again, from the North, Midwest. So next, I'm going to transition to older Latinos' cognitive status in the United States. So just very quickly, the significance of this research. We know Alzheimer's disease and related dementias represent a significant public health concern. There are approximately 5.7 million individuals in the United States currently living with ADRD, and this number is projected to grow significantly. We know that there are very costly healthcare, medical and long-term care expenditures for treating individuals with dementia. ADRD is also the 6th leading cause of death in the United States. And again, there's a large number living with dementia. Specific to Latinos, we know that the prevalence of ADRD is higher among older Latinos compared to whites due to several factors, mainly longer life expectancy, higher prevalence, as I illustrated, of certain chronic conditions that are associated with ADRD risk, including diabetes, cardiovascular, and hypertension. Low educational attainment, again, as I illustrated, and also exposure to environmental risk factors, such as poverty and segregation. And more importantly, I'd like to point out is currently that there are no empirical studies that use a nationally representative sample to examine differences in cognitive decline, cognitive impairment, and dementia within older Latino subpopulations. This is very important. And again, just projections by numbers. I want to be clear that this is very significant and impacts all groups, and that the prevalence is increasing with time, as we expect with increases in population aging and the diversity of the population. We also know from research that there are significant differences by gender among all groups, and that both Latinos and Hispanics are disadvantaged compared to the non-Latino white population in the prevalence of dementia. Here in particular, this is data with the HRS, just to be clear. So with all that taken into consideration, it's important to ask, well, what do we know about older Latino health? Right? There's been a lot of studies based on nativity status and health. And whenever we talk about the Latino population and Latino health, the concept of the Latino paradox or the epidemiological paradox always arises, right? And this basically states that Latinos fare better in several health outcomes, but particularly mortality, despite their low socioeconomic status, right? And this has largely been attributed to the healthy immigrant effect. That is, immigrants from other countries, particularly from Mexico, right? Immigrants who migrate to the United States are healthier than the population that they leave behind in their country of origin, and they're also healthier than the population in the United States, right? And this makes sense. The vast majority of older immigrants, particularly males, are labor migrants. They migrate for occupational and economic purposes. So these individuals, by definition, labor migrants, are healthy enough to make the journey from the country of origin to the US and work many times in physically taxing and low paying occupations. However, when we look at the current literature, what we know is that the mortality advantage, lower mortality, increased longevity among Latinos does not extend to other health outcomes. Particularly, there has been a couple of studies that come up looking at morbidity, looking at disability, as well as cognition using various data sets. And what this research indicates is that while there is greater longevity among older Latinos, many times it doesn't coincide with better health. Right? So additional years added or additional years in life compared to other racial groups are largely years of impairment or years of dependency. And importantly, this differs by nativity status, with US-born Latinos exhibiting health status that is more indicative of their minority status in the United States. Whereas the foreign-born largely, we witness this healthy immigrant effect and mortality and some outcomes, some early life outcomes, but later in life, due to their longevity and due to many of them working in physically taxing population, the body takes, the body experiences wear and tear, where we see they spend much more years of late life with disability, with morbidity, as well as cognitive impairment and dementia. I see a hand raised.
Yes. Hi, I'm Gracie. Thank you so much for your talk so far. This is absolutely fascinating and really cool. I was curious in terms of the longevity piece. I mean, I think you can probably infer it a little bit, but I was wondering whether anybody has also looked at that question of the quality of life for those longer years and whether there's difference across populations, not just in function, but in like perceived and experienced quality.
Mm-hmm. Yes, that's very important. There has been research, and some of my own research I'm going to present is going to touch on that, and we could circle back. And that's the main thing. You bring up a very, very important point, right? Regarding longevity. The goal of many individuals is to live a long, healthy life, right? But we see that for many individuals, this is not the case, right? There is not we do not witness a compression of morbidity or disability and cognition among racial and ethnic groups. And then I'll touch on that a little further, but please remind me if it slips my mind. So moving forward to some of my own research with the health and retirement study, I tried to answer some of those very questions. Very quickly, this is just a sample population and the incisors that I'm looking at. And I was very interested in this question, right? Differences between longevity, right? Length of life and quality of life. And in this study, I looked at cognitive life expectancies by race and ethnicity and among Latinos by nativity. And then the results I'm about to show you, I also stratified by gender and age groups. So again, I covered that just very quickly, the measures in the HRS. For those who are familiar, the HRS uses the modified TICs. Here are the cutoffs. This is based on the Langmuir algorithm, and I'll talk a little bit more about that at the end of my presentation. And included in this algorithm, there are measures for proxy classifications, which is very, very important. And in this analysis, what I did was I ran Sullivan life tables. I was interested in the number of years after age 50 a population can expect to live in a particular cognitive state, cognitively normal, CIND, which is cognitive impairment with no dementia and dementia. And just the calculations here are based on age-specific prevalence of CIND and dementia and age-specific mortality information. So just to get on very quickly to the results, this paper was published in 2019. And here in the squares, what I have is I'm highlighting both US and foreign-born Latino women as well as men. What we could see here for women is that even though women, US born too, have comparable life expectancies as non-Latino whites, US born Latino women are spending significantly more years with dementia and cognitive impairment, as well as less years with normal cognition. When we look at the foreign-born women, we see, again, the same pattern, but just slightly worse. And up here on the top, to get at quality of life, what we have are the ratios lived healthy. So for instance, for foreign-born Latina female at age 50, right, foreign-born Latina females could expect to live 18 years cognitively intact, or approximately 51% of their remaining life with good cognition, right? What this shows is that foreign-born Latina women are spending approximately 49% of their remaining years after age 50 with some form of cognitive impairment. And when you look at racial and ethnic differences, well, non-Latino white women are spending approximately 32% more of their remaining years cognitively healthy. Right? This is what we all aim to achieve in life. Right? We get old, we go through the aging process, somewhat smaller period of compressed morbidity, right? And then we die. However, for other groups, again, particularly the women, we see large portions of their remaining life after age 50 with cognitive impairment and dementia. A follow-up study that was published this year looked at the same racial and ethnic and nativity groups. However, this time I wanted to see the returns on education. Up top, we have individuals with less than high school, individuals who have a high school degree, and then individuals who have some college or more. Again, this is the HRS. This is the using the same data I previously presented. Excuse me. And here we'll begin with looking at women who have less than a high school degree. So, looking at cognitive statuses, you could see again large disparities, particularly among the foreign-born, where foreign-born women with less than high school education are spending approximately 44% of their remaining years cognitively healthy. Right? I'll just go back and look at the difference. Well, okay, so 51% for foreign-born as an aggregated group, but when we look at education, and the vast majority we know per the data I showed you, the vast majority of the foreign-born has very, very low levels of education. And we could see the number of years spent cognitively impaired and the numbers of years spent with dementia among this group. Very, very significant that the remaining years after 50, less than half of the remaining years after 50, they're spending, both US born and foreign born Latino women are spending in a cognitively impaired state. With increases in education, we see also increases in time spent cognitively healthy, as well as decreases in the number of years spent with CIND and dementia. And again, with higher education, we see similar patterns across groups. However, I would like to note that the returns for education are not the same, and we could measure this by the racial healthy. Latinos, regardless of nativity status, lag behind non-Latino whites, regardless of educational attainment. And I think that's very, very important. And here, again, this is males. I'm not going to go through it, but very, very similar pattern. However, I will note that males, the results for males in this particular study were that males were spending a larger proportion of the remaining years compared to females in a cognitively healthy state. Okay, next study. What I previously presented to you is based again on privilege and age, and the purpose of these studies was to document the overall burden of ADRD among older Latinos. Well, one of the things a lot of us do, demographers and those studying population health, well, that's very, very informative information, but how does cognition change over time? And is this change different for different racial and ethnic groups? Here are just some of the measures that I include in the study. This is HRS data. Again, I'm using the same data, but I'm interested in cognitive trajectories over time, including a host of indicators. So I'm going to get to the meat of the story right here. Younger age differences, as we could see, older and U.S. born or older U.S. born Latinas, I should say, have lower cognitive scores compared to whites, and we see this both for the U.S. born and foreign born population. However, when we look at associations between age and cognitive change, we see that white women, right, have more pronounced cognitive aging compared to U.S. born and foreign born Hispanic women. And for males, a slightly different story. We see differences in cognitive functioning are mainly evident at younger ages. And also, these changes are more evident among African Americans than it is among Latinos. However, the important thing to know is that there was no statistical evidence of cognitive change over time. And there was just, for this particular study, did several robust checks looking at specific domains. This is the memory domain where the results remain robust. And also doing a sensitivity, looking at different time periods to see if there were differences. The results of this study stood. Okay, so I talked to you about nativity differences by nativity status, by gender, and educational attainment. But one of the things that I aim to do in my research is to further examine the demographic heterogeneity among older Latinos. We know, as I showed, that there are important factors that contribute to health over time. The results I'm about to show you are also used with the HRS. What I aim to do with this study is introduce a conceptual framework, which is life course age of migration. We know nativity is important for differentiating health. Results have shown that. We know that there is a foreign-born advantage. Results have largely mirrored that early in midlife with disadvantages in late life. So where you are born is very, very significant, and it's an important factor. When specific to age of migration is an important factor to examine health outcomes among the foreign-born because it could be used as an indicator for type of migration, whether it was occupational versus family reunification, the degree of health selectivity, opportunities for incorporation into U.S. mainstream institutions, as well as exposures both from the country of origin and the United States. Here, I'm adapting this table from a paper published by Zoe Wiskaya in 2014. And I'm using these age categories. And I'm just going to walk through them very quickly. What we know from previous research using the HRS and other studies or using regional data is that age of migration is a very important factor. One, when we think about early life migration, for instance, these individuals right here are likely to immigrate with their parents, right? Particularly at the younger ages, such that their health selectivity should largely mirror that of their parents. Although research has showed that there is a slight advantage among this foreign-born age of migration group. What happens is this group, for the most part, if they come over at young ages, they're raised as United States citizens, right? They live here, they go to school here, their educational experiences and their overall experience largely mirror that of the native-born population. Because of the incorporation through education, we see that they are able to socioeconomically incorporate to other mainstream institutions, which helps them, right? Which helps them with higher income, healthcare advantages, as well as increases with wealth and other resources over time. Among individuals who migrate in midlife, research has shown that these individuals are largely migrant workers. They're very, very health selective, right? As far as negative acculturation, there is some negative acculturation among these individuals because even though they come at older ages, they are still at an age where they're able to easily adopt some negative health behaviors, right? Diet, smoking, drinking, that we all know affect health. Because they come at a younger group, there is still some positive effects for incorporation, right? They have more opportunities, again, to accumulate wealth and incorporate. Among individuals who migrate in later life, here 35 years and older, most of these individuals have migrated for family reunification purposes, but there is still a substantial number who are young and migrant workers, though their research has shown that their health selectivity, though greater than early life migrants, is not as robust as those who migrate to the United States in midlife. And just the demographics again, and here we have cognitive life expectancies among older Latinos by nativity status and age of migration. And very quickly, I will just say, among women who migrated in early life, they exhibit the worst cognitive life expectancies. That is, they exhibit the poorest amount of years and the proportion of life with CIND and dementia. And we could see for women among the 35-year group, they also have, when we look at the proportion of years spent healthy, we also see that they are at a significant disadvantage compared to the US born and also compared to midlife migrants. For males, we only see this disadvantage largely among early life migrant groups. And I'll go into this later for the sake of time, but one thing I would really like to do is illustrate, present to you results from a study that has recently been accepted this past month. For this study, I used the National Health and Interview. Again, I use multiple analyses, including cognitive life expectancies. Just very quickly, for those not aware, we know that the NHIS is cross-sectional, it's not longitudinal, so there are some limitations with that. However, one of the reasons that I pursued this data set is because the large sample of older Latinos by nativity status and country of origin. And here we have just very quickly the distribution of my sample here, and similar results with the NHIS that I presented to you from the other studies. There's large variation in individuals who speak Spanish, primarily in educational attainment, and the proportion of individuals living in poverty, as well as individuals who have healthcare coverage. Right here, just very briefly, these are age patterns and how they differ by groups. Same thing for males, large variation by age patterns among groups between US whites and Latino subpopulations. So here again are life expectancies, this time looking at self-reported cognitive impairment. As we can see, there is large heterogeneity among older Latinos too. Generally, what this research shows, similar to other studies with the NHIS, is that Puerto Ricans, in this case, island-born Puerto Ricans, as well as US-born Mexicans, are particularly disadvantaged compared to whites, whereas foreign-born Cubans and to a lesser extent, foreign-born Mexicans exhibit health, right, health selectivity among self-reported cognitive impairment compared to the other Latino subgroups. And again, this is just similar results for men. Another way to look at this that I wanted to show you is it's very important to look at heterogeneity among these groups. And here, I think this figure pretty much tells the whole story, right? When we view older US Latinos in the United States, and again, this is self-reported cognitive impairment, we see that the group as a whole is disadvantaged across these different age categories relative to non-Latino whites. However, when we disaggregate these groups, we see large heterogeneity among Latinos by nativity status and country of origin. And looking at cohorts, as you can imagine, this is just another way to illustrate the data and the heterogeneity among this population. I'm going to skip that very briefly for time, and then I'm going to move on to the pandemic and how it has affected Latinos. The reason I do this is moving forward in the future, I think it's very important for us to contextualize the periods as well as other things, specifically when we look at these outcomes. And the research that I'm showing to you right now is all pre-pandemic. However, we know that a lot of racial and ethnic groups have been disproportionately impacted by the pandemic, and this is going to have devastating effects for the future health and cognition of Latinos. Very quickly, we're all living through the pandemic, so I don't have to go into that. There are several risk factors for COVID-19 infection, hospitalization, and mortality. A paper I published last year with several colleagues documented this with CDC data that older Latinos and African Americans are disproportionately impacted in mortality. Other research has showed that Latinos, as well as other groups, are not just disproportionately impacted in mortality, but also in the number of positive cases and hospitalizations. And again, this varies by context, right? We know that there has been differing responses to the pandemic by state in regards to vaccination, as well as shelter-in-place strategies. Importantly, when we look at COVID-19 mortality among Latinos, we see that compared to whites, that the vast majority of mortality has happened at younger groups, right? So here we see approximately 63% of COVID-19 mortality is among older adults. However, among these younger groups, we see large disparities in mortality among the 50 to 64, as well as Latinos under the age 50 groups relative to whites. And if you want to look at the specific age categories, here's a paper I published with my colleague Rogelio Science, where we also documented differences in COVID-19 mortality by race and ethnicity. Other researchers have also shown the devastating effects of COVID-19 and the estimated effects that COVID-19 is going to have on the life expectancy of the population in the United States. Not just total life expectancy, but life expectancy, not just life expectancy for the total population, but life expectancy under other groups, both at birth and at age 65. And then we see the steep decline due to the pandemic. Shortly hereafter, the CDC followed up with a similar study looking at the same groups, I should say. Importantly, they documented that among Latinos, that Hispanic males are projected to experience the largest decrease in years of life expectancy. To further explore the impact of COVID-19 mortality among older Latinos, one of the things I've tried to do is further explore the effects of the pandemic. Previous research, as I mentioned, was published last year. However, one of the things that me and my colleague are interested in is looking at period effects. Does the mortality for older Latinos differ between 2020 and 2019? Here on the left, I have the cumulative end dates right here, but importantly in red, these are, for these particular dates, this is where Latinos exhibited higher mortality than whites, right? So for these particular age categories and age categories and time, what this tells us is that the Latino paradox in mortality was no longer evident. And across the group for 65 to 74, this is very, very robust, and this has been consistent regardless of time period we're looking at. On top, looking at individual states is one of the things that I'm particularly interested also. Up top, we have 2020 COVID-19 mortality and below 2021. As we could see, for instance, here in New York City, as you recall, was the epicenter of COVID-19. However, in 2021, New York, as well as Illinois and other states, have we see declines in the disparity, the COVID-19 mortality among different states. However, it's important to note that there are certain states, particularly California, where the declines have not been as great. And there are studies that have, and here's just the other top 10 mortality for the top 10 COVID-19 mortality states by period. And when we look at this COVID mortality, what accounts for these shifts that we've seen? As I said, the disparity is still there, although it has declined, and it has not been equal the declines across states. Part of this, we posit that this is due to COVID-19 impacting Latinos, Blacks, as well as other groups early on. There was large surges within this. And more and more recently, what you see is Latinos are getting vaccinated at higher rates, right? So this certainly contributes to it, particularly in hard-hit areas, for instance, in the Texas border region, as well as California. Another possible explanation is what we know that the mortality advantage among Latinos is more robust among older adults, which could have possibly contributed to those results. And again, just talking about vaccination and increases of vaccination, here we could see, particularly in the South Texas region, where I had mentioned that was particularly struck hard, very, very high rates of vaccination, similar to the border area along El Paso and large communities, large areas where there's large populations of Latinos, as well as those in the East Coast. And I just want to quickly touch base that we know also that the COVID-19 impact has also devastated the Latino population as well as other populations economically, right? And here, this is a paper I have on the review using the HRS COVID-19 module. And we could see that there are large disparities among the Latino population in decreased income, and particularly in the number of hardships. And then when we look at specific hardships, we could see that the US born and foreign born Latinx population are disadvantaged relative to other groups in missing payments, electricity, medical bills. You see a large foreign born disadvantage, lack of money for food, as well as other indicators. Of course, none of this should be surprising. We know there's large and long-standing structural inequalities in the United States, as well as we know that the vast majority of Latinos, there's a lot of exposure due to essential workers in certain industries, as well as environmental hazards and a host of different factors that contribute to the disparities that I've shown you. As far as moving forward, what does this mean for the health of Latinos? What does this mean for the cognitive health of Latinos? Well, it's not very clear, right? There's still a lot of uncertainty going on. We still need a lot more data collection so that we could document these differences, right? There's been a lot of talk, well, that COVID-19 has exposed disparities. For those of us who do population research, we know these disparities have existed for decades and decades, right? This is nothing new. They've exacerbated disparities is what they've done. And then they just have, so many effects moving forward that we don't know, right? If complications from COVID-19 infection, we do not know how decreases in life expectancy is going to affect cognitive aging as well as our other health outcomes, disruption of social networks, among other things, right? And specific to COVID-19, there is a real concern of what some have called long COVID and the effects of long COVID. And this is not just for older adults. This has been witnessed among younger populations also. So what does this mean? I'm not sure how it's going to affect it. I'm sure there's a lot of people, I have more questions than I have answers, but it's important that we collect quality data, right? So we could explore these questions. And, I'm not going to get into this too much, but hopefully the current administration, there's a lot of items on the agenda as far as the safety net and healthcare coverage and other benefits that would certainly benefit Latinos and other populations. And other than that, apart from COVID, just some of the future directions that I'm thinking about is obviously contextual factors, which are very, very important, as well as biological risk. And of course, none of our research would be possible without funding. So hats off to my colleagues at the University of Michigan. And I'd be happy to take any questions or discuss any of the results I presented. Thank you.
Wonderful. Thank you so much, Dr. Garcia. I'm seeing a lot of hands applauding, and I'm also seeing one hand up for a question right now. Michal, please.
Thank you so much for this talk. You've given us lots of things to think about that are really fascinating and a lot of implications. So it's hard to choose actually what to ask you about. But I wanted to talk to you a little bit more about this intriguing finding that you showed us about the sort of the despite greater longevity, which we've talked about for a long time in terms of this Hispanic longevity advantage. What you were showing us with the cognitive data is similar, is that despite that, there is sort of a disadvantage in terms of life with cognitive decline. And this is reminding me also of some other findings that have found similarly a greater burden, like you mentioned, of some chronic diseases and of disability, right? So it's really like pointing out that these populations are perhaps living longer, but they have greater needs during these years, potentially. And particularly with the case of cognition, especially cognitive decline, it's making me think of the need for caregiving. And that's also something that's really different across populations, right? So particularly in immigrant communities, in these Latinx communities that you're talking about. And so I wonder if you could talk a little bit more about the implications of all this for caregiving, for the demands for it, the burdens, and also what this potentially means for the health of the caregivers, because it's not easy to care for people with dementia.
Great. Yeah, there's a whole lot going on right there. I will say the caregiving burden is very, very significant among minority populations. This is not necessarily my area, but there's a host of researchers, including there at Wisconsin, that are doing excellent work in the caregiving burden. What I will say, some of my research that has used the Hispanic EPIs, which is a longitudinal study that spans over 25 years, I think now. In recent waves, what they've done is that they have a caregiving module that's linked to the original respondents. This particular sample, just background, they're Mexican origin individuals living in the 5 southwestern states, 65 years and older. And initially, with the initial sample and other research, what we see is that the burden falls largely among daughters within the Latino community. Just very quickly, I will say there's other researchers. One of my colleagues, Jason Resendez, is advocating for paid leave. Right? This is very important because not just when we think about the pandemic and just the childcare, but there is also a lot of individuals who have exited the workforce to give care for older adults. And we see this burden, a very high burden among Latino communities.
Wonderful. Thank you. Christine, I see your hand.
Hey, thanks so much for a really interesting talk. About midway through your talk, you showed some really interesting gender differences in the Latino population in cognitive decline, the kind of the percentage of years lived. And I was just wondering if you had thoughts about that.
Yes, a lot of thoughts. So a lot of research, particularly specific to ADRD, you're seeing a lot of calls right now for sex differences, right? We know that there's racial and ethnic differences, but and a lot of research, including what I've shown, I stratify by sex. Most of the results are stratified that I showed you are stratified by sex, but we know that there are important differences, right, between men and women, particularly among foreign-born men and women in levels of education, right? And as I talked about, the type of migration, and all of these factors are important for cognitive aging among the Latino population. Moving forward, it was scribbled in there somewhere on one of those slides. But my own research, I'm looking to specifically test sex gender differences within the Latino population. Did I miss one more thing in your question? I'm sorry. Okay, all right, thank you.
Thank you. Gracie, I see your hand.
Yeah, thank you. Thank you again for such a great presentation. A lot in here to like think about. I was wondering if you could speak at all. I know there's a growing interest in the literature regarding racialization of ethnicity in the United States, particularly around immigrants. And I was wondering if you had any thoughts about whether that comes into play either broadly or specifically in terms of the sending countries and the immigrants that are coming from them in terms of their long-term health and some of these outcomes you showed.
Sure, yes, definitely. As we know, most of the research, the Latino population has viewed Latinos as a foreign-born group, right, as an immigrant group, right? Even though despite certain groups being here for long periods of time, there are also differences, and again, I briefly touched on this, and the receptivity of different groups. For instance, Cubans were accepted, come on, come here. Mexicans, not so much. Puerto Ricans, also, again, slightly different. And when we talk about discrimination, I think about a lot of things, politically, where you live, contextually, all that's very important. But with the previous administration, we witnessed a lot of this, not just for Latinos, right, but for other groups also. But just the impact of the former president coming down the escalator, making, well, Mexico doesn't send us, and all that certainly has an impact. Myself, as you could say, phenotypically, I'm not white, even though racially and legally I am white in the United States. I'm racialized as not white. I think that's very, very important, right? Some individuals hold on to the whiteness for multiple reasons, right? But one thing that I will say is that we've also witnessed over the past, because I would argue because of this racialization, we've also witnessed that people are choosing to identify different, right? Latinos to a large extent, previous older cohorts identify as white. But younger cohorts, well, not so much, because I think they've been racialized, right? So, well, I'm going to identify as multiracial, multi-ethnic, and there's options. And you see this also among other populations, multiracial populations, multi-ethnic, there is an increase. So I think with the 2020 data, census data that we received, there's been all this talk about the white population declining. But I think there's a little more going on. It's also how we identify. And just to add something to that very quickly, there's a lot of sister studies in different countries from the HRS and other studies that are now adding these racial categories. For instance, Mexico just recently added racial Black to their census, I think, in their last census 10 years ago. But, to think a whole country, there's a lot of Afro-Mexicanos, right? Just like there's a lot of indigenous, but now there's more options for individuals to identify in these categories. And I think because of the political climate and because of racialization, this also affects, it has a lot of effects on the cognitive functioning of older Latinos, whether it's through discrimination in the workforce, whether it's through wages, whether it's through education. You could talk about a host of issues, but definitely. What we need is more data to get at that.
Thank you. I see your hand.
Yeah, thank you for your presentation. That's very informative. I'm particularly interested in the measurement of cognitive function. I'm wondering, what skills more reliable than others, because there are so many different measurements of cognitive function and even dementia. Also, what I'm wondering whether there are some issues about measuring this outcome, as far as I know, in terms of some health outcomes, there are racial difference of the reliability of the measurement. Like some measurements are more effective in whites, among whites, but not effective in other races. So I'm wondering whether cognitive function also have this kind of problem.
Mhm. Yeah, no, great comment. There are all types of biases. We know that, particularly in with self-reported data. One of the things, and I thank you for bringing up this question, because I don't think I went over it in future research, but there has been, specific to cognition, there has been a couple of papers that came out over the past couple of years that use different algorithms than the one I used to measure cognitive functioning. As a matter of fact, they state that the algorithm, the LingoWeir algorithm, is not adequate for Latinx populations. And so moving forward, one of the things is to try, for me, is to use these different measurements to see and get at the biases of these instruments, right? Because we know a lot of these instruments that measure cognition, TICS in the HRS, there's the Benny Mental, for instance. There are different cutoffs for different groups based on education and what have you, and it makes it very difficult, right? And this leads to a bigger point. There is also, I think, we're hearing a lot more lately about the recruitment and retention of minorities into population studies, right? Who are these individuals who are in there, and are they selected? But we need to do a better job of recruiting more individuals, more minority individuals, particularly for cognition, for clinical tests, for drugs, and what have you.
Thank you. I think our last question, if we've got time for it here, is Sabrina, please.
Sure.
Hi, yeah, real quick. Thank you so much for your presentation. I'm also interested in disaggregating Latinx health outcomes, and something you discussed and that I'm grappling with is how place is really important in impacting Latinx health heterogeneity in many material and immaterial ways. For example, segregation and racialization of immigrants vary by place. Could you just speak briefly about some of the relevant and feasible spatial measures that you are exploring and using?
Oh, in a minute, that's tough. I will say that and we could follow up, but I'd be happy to talk with you. I just think for this particular, we're out of time. But I will say that it's important to look, for me, and I would recommend for you, to look at differences, whether individual level characteristics or contextual level characteristics differentially affect different groups. For instance, just very quickly, Puerto Ricans and most Caribbean Latinos are phenotypically Black, and they live in environments similar to that of African Americans. It's why you see a lot of the results that I showed that relative to other Latino groups, they have the poorest health outcomes.
Wonderful, thank you. And I appreciate that invitation to connect. So perhaps Sabrina, Mark, you can stay on a little bit here. Thank you so much, Dr. Garcia. Before we thank you, I'm just going to quickly remind folks that next week we'll be meeting in hybrid format as we host Columbia University's Tom Dupreet. Dr. Dupreet, many of you know, is a comparative scholar who has significantly shaped the study of stratification. So join us next week for that. And before departing today, please join me in thanking Dr. Garcia for a truly insightful, informative, very rich, engaging presentation. Thank you.
Thank you very much.